Choking happens quickly, so it's important to be prepared in case you need to help someone in distress. Choking occurs when something gets stuck in someone's airway and makes it hard for them to breathe. A person experiencing mild choking can still breathe, speak, and cough. You may not need to intervene in these cases. A person experiencing severe choking can no longer breathe, speak, or cough. This is an emergency. Anyone who has severely choked should be seen by a healthcare professional.
It's not always easy to tell if someone is choking. If you're unsure, ask the person if they are choking and if you can help. If the person's face becomes discolored, if they're struggling to breathe or make sounds, or if they're grabbing at their throat with their hands, they are severely choking. If someone else is nearby, have them call 911 and get an AED while you help the person who's choking. Stand firmly or kneel behind the person depending on your size and their size. Put one foot in front of the other to give yourself a steady base and place one hand on the person's shoulder. Then, use the heel of your other hand to give them 5 forceful back blows between the shoulder blades. This will push air from the lungs, helping to force out the object that's blocking the airway. If the 5 back blows do not clear the airway, move on to abdominal thrusts. To give abdominal thrusts, stand with your feet shoulder-width apart and one leg slightly forward, like this. Wrap your arms around their waist so that your hands are in front. Make a fist with one hand and place it thumb side against the person's waist, just above the belly button and well below the breastbone. Now, grab your fist with your other hand. Next, give quick inward and upward thrusts to the abdomen, making sure your thrust goes upward and not straight back. Thrusting upward acts like a cough, pushing the air out while reducing the chances of causing injury to internal organs. Alternate between giving 5 back blows between the shoulder blades and 5 abdominal thrusts until the object is forced out and the person can breathe, cough, or speak, or until they become unresponsive. If you can't wrap your arms fully around their waist because they're larger, pregnant, or in a wheelchair, give chest thrusts instead of abdominal thrusts. In these cases, you'll need to change your hand position and pull back on the chest, not up on the abdomen. Now, I'll demonstrate the correct hand position for chest thrusts. Make a fist with one hand and place it thumb side against the person's torso. Place your arms under their armpits and your hands in the center of their chest on the lower half of the breastbone. Pull straight back to give chest thrusts. If the person becomes unresponsive, carefully slide them to the floor face up by slowly walking backward, supporting their head and neck. Start CPR immediately and use the AED as soon as it's available. Have someone call 911 if they haven't already done so. After giving 30 chest compressions, look in the person's mouth to check if the object has come out. If you see an object, take it out. If you can't see the object, do not reach into their mouth to try to find it. You can accidentally push the object in farther and make things worse. Now that you've checked for the object, give 2 breaths. Continue cycles of giving 30 compressions, checking for the object and giving 2 breaths until emergency responders arrive or the person starts responding and breathing normally. If you're alone with someone who becomes unresponsive after choking and you do not have a phone, it's important to complete 5 cycles of CPR, starting with giving 30 compressions, checking for the object, and then giving 2 breaths before you leave to call 911 and get an AED. Now you're ready to help someone who is choking.